wherever you are. Okay, so I believe we're live streamed and we are on the move, so go for it.
Okay, good afternoon, everyone. This is Monday, August 9th at 3 p.m. and this is the regularly scheduled meeting of the Lincoln County Board of Commissioners. We are being held virtually via Zoom. First order on the agenda is to call the meeting to order, and I have done so. We have all three commissioners present, which does constitute a quorum. Next item on our agenda is a resolution recognizing National Health Center Week. And Commissioner Hall, do you have the resolution so that you can read it? I do, if you would prefer.
And I can pull it up on the screen too, if that helps.
You're being muted. You're not being muted. You are muted.
Okay. Am I coming through now?
Loud and clear. Thank you.
Okay. In the matter of declaring August 8th through 14th, 2021 as National Health Center Week in Lincoln County. Whereas for over 50 years, community health centers have provided high quality, affordable, comprehensive primary and preventative health care in our nation's underserved communities, delivering value to and having a significant impact on America's healthcare system. And whereas, as the country's largest primary care network, community health centers are the healthcare home for 30 million Americans in over 14,000 communities across the nation. 1 in every 12 people in the United States gets their care in a community health center. And whereas community health centers are a critical element of the health system, serving both rural and urban communities. Nationwide, community health centers serve 1 in every 5 residents of rural areas. And whereas Lincoln Community Health Center, with locations across Lincoln County, is celebrating its 15th year of providing high-quality primary care, behavioral care, immunization, and maternity case management services to members of the community. And whereas in Lincoln County, the Lincoln Community Health Center operates 8 sites and in the most recent year treated more than 4,000 individuals for primary care and mental health needs during the worldwide pandemic. Whereas the Lincoln Community Health Center also adapted to the unusual circumstances of 2020 by supporting public health during the COVID-19 pandemic by providing drive-up testing, as well as assisting in mass vaccination clinics, and by staffing the Red Cross Emergency Center for wildfire evacuees during the Echo Mountain fire, and providing ongoing support to those displaced after the fire. And whereas community health centers, including Lincoln County's, are governed by patient majority boards, ensuring that the patients are engaged in their own healthcare decisions. And whereas the community health center model continues to provide an effective means of overcoming barriers to healthcare access, including geography, income, and insurance status, improving healthcare outcomes, and reducing healthcare system costs. And whereas during National Health Center Week, we celebrate the legacy of America's community health centers and their vital role in shaping the past, present, and future of America's healthcare system. Now, therefore, be it resolved that the Lincoln County Board of Commissioners declare August 8th through 14th as National Health Center Week, and as such, offer our thanks and appreciation to the Lincoln Community Health Center for its contributions to the health and wellness of our community.
Thank you, Commissioner Hall. I believe Carolyn Crandall, you're going to offer some remarks. And you're on mute. I will note that you are a representative of the Health Council, a member of the Health Council.
Yes. Can you hear me now?
There you go. There you go.
Great. First of all, thank you for having me and to represent the Health Council on this really important day and resolution. We really appreciate it. So I'm just going to continue. I'm going to read some of my notes here explaining who we are, what we do. This week is National Health Center Week, and I'm here to provide a brief history and highlight some of Lincoln County Health Center's accomplishments. National Health Center Week, August 8th through the 14th, is an annual celebration with the goal of raising awareness about the mission and accomplishments of America's health centers over the past 5 decades. The theme of this year's annual celebration is the chemistry for strong communities. We come together this week to celebrate the roles community health centers have played in both our recent moments of loss and triumph. This National Health Center Week honors those frontline providers, staff, and in the ongoing COVID-19 pandemic. Lincoln Community Health Center was established in 2006. It is comprised of 2 primary care clinics, one in Newport and one in Lincoln City, 4 school-based health centers in the 4 high schools, and 3 specialty behavioral health clinics, one co-located with primary care in Lincoln City and Lee Street and Nye Street's clinics in Newport. Behavioral health is also provided in each of the 4 school clinics. Dental services are also provided through a voucher program for uninsured individuals. The mission of Lincoln Community Health Center is to improve the quality of life and health of individuals living in Lincoln County, Oregon, providing access to high-quality primary care, mental health, addiction, and dental services, regardless of ability to pay. The health center receives some federal funding to offset the cost of serving the uninsured, but it also accepts most insurance and has a sliding field discount program for those who qualify. In 2020, our health center provided services to 4,011 unique individuals. In a normal year, this number hovers around 5,000. During 2020, despite COVID-19 and the wildfires that ravaged the northern part of the county, the health center continued to serve patients, offering telehealth options in addition to in-person appointments with COVID workflows instituted. One of the important functions of a health center is to work to prevent unnecessary emergency room use when possible, which is especially important during a pandemic. Our health center supported the COVID testing and vaccination with a drive-up testing station at the Newport 1010 clinic, gave vaccinations to HHS staff, and assisted public health by providing staff at the mass vaccination clinics. With the recent surge in cases, the drive-up testing station is back in action, testing weekly on Wednesdays. Our health center responded to the wildfire emergency and set up the medical site at the Red Cross Evacuation Center and provided medical triage and care in addition to the behavioral health response for those impacted by the wildfires. An initiative recently implemented in primary care and is currently underway in behavioral health is screening for social determinants of health. These are things like identifying and addressing food and housing needs and transportation barriers. Addressing these barriers reduces health disparities and increases access to high quality health care. Health Center Week has a specific focus on each day. Today's focus is healthcare for the homeless. Collectively, health centers serve 1.3 million individuals experiencing homelessness each year. People who experience homelessness incur a number of health issues on the streets or in shelters, and being without housing can exacerbate current health conditions. People without homes endure higher rates of chronic and acute disease, behavioral health conditions, and other needs that make them particularly vulnerable to poor health, disability, and early death. National Health Center Week is a time to honor and celebrate the work being done at health centers and to advocate for policies that end homelessness by providing comprehensive housing and health care as a human right. Chemistry in our community creates a vibrant healthcare model. By providing these essential healthcare services, we form strong bonds with our patients, their support systems, and one another. Thank you, Lincoln Community Health Center staff, for the important services you provide to your patients and the community. And thank you for allowing us to tell you all about us.
All right, thank you, Carolyn. Are there other individuals that wish to comment on this resolution? I know Mary Jo, the program manager, I believe of the Lincoln City Health Center, has a community health worker presentation. should we move to that, or commissioners, do you wish to comment on this before moving on? It's all part of the resolution, I believe.
I think I would like to hear from Mary Jo, and then I'll kind of make my comments after hearing that as well. But thank you for presenting, Caroline. Appreciate it.
Again, I'll note that Caroline is one of, what are there, about a dozen members of the Health Council, Carolyn? You're muted.
No.
There you go.
We currently have 9 members.
9 members.
Yeah, 9. And we meet once a month. It's the second Tuesday of each month at the, we call it the Western Title Building, but now, of course, we're on Zoom. Personally, I am a consumer. I get my health care at the Newport Clinic, and I couldn't be happier. It's a wonderful place to go for your health care. Everybody's friendly, knowledgeable, and you're treated with the utmost of respect. So it's a great place to get your health care.
All right, thank you. We'll move on to Mary Jo.
Thank you, Carolyn, for those kind comments. And thank you to the commissioners for giving us this platform to share our story about this role of community health workers. I invited part of the team, not all of our community health workers, but some of them were able to join us so that we can kind of bring this to life and tell you their story. I don't know, Casey, if you have our presentation. I had sent it to Christy, or if you want me to share my screen.
Yeah.
Oh,
We-
excellent, excellent. Okay. As Commissioner Hunt said, I'm one of the program managers for Lincoln Community Health Center. I'm primarily located at the Lincoln City Clinic, but also cover in Newport. And we do work as a team. We have some great care teams and providers, and I'm just really honored to work with these community health workers who really are championing looking at the social barriers, screening for those social determinants of health, and really being the connection between what the patient needs and helping them navigate the health system, trying to get them set up with their resources. So I think that this is an integral role. It's also not a new role for Lincoln County. I think we have kind of led the way as far as health centers, actually having some of the community health workers in this role before it was formalized and certified. We can go to the next slide. Really just talking about the history of the community health worker model. And across the country, they're not always called community health workers. Some clinics call them health navigators, traditional health workers. So even within Lincoln County and within HHS, we have a number of different departments, and maybe some of our roles are a little bit different, but we have a group of community health workers that really are doing this similar work. They walk alongside individuals in the community, really helping them personalize what it is that they need or what barriers they have so that they can achieve optimum health for them and really make the community as a whole healthier. Currently, this is our community health workers that we have in primary care, behavioral health, maternal child health, public health. And as you can see, they're in very different departments, but doing similar work. This group meets monthly to talk about shared resources, tackling some of the challenges, and really supporting each other. And like I said, I've been honored to work with them, and I'm glad that some of them could join us today. So you're going to get to meet some of them as we go along here. I think Paula Ferguson and Lloyd Comstock are going to talk to the next slide that really talks a little bit about some of the services that CHWs provide, and then the requirements that really, now it is a certified role. They have to take some training, get certified. It really is a specialty. So Lori, are you with us?
I am. I was just checking to see if Paula was jumping in, if she was here. So
Well, just introduce yourself and yeah, take it away.
Okay. Good afternoon, everybody. My name is Lori Comstock, and I am working with maternal and child health, supporting the nurse home visitors, and I'm also been certified as a community health worker. So we were going to talk a little bit today about the requirements for a community health worker, and currently there's a state certification training, and fortunately, Mary Edwards and I were the first to be able to do that in our community a couple of years back when they offered it, just as kind of an introduction. So that was really great to be a part of that. And Cedar and Paula were also there as well. The certification training really connects you to how to work with clients and individuals, the ethical pieces that are really an integral part of walking alongside of clients and patients as we work with them. And the rules and regulations, for example, HIPAA, how important that is to the integrity of the care that we provide. Currently, the certification lasts 3 years, and it's through the OHA Office of Equity and Inclusion. And then at that 3-year point, you would need to continue to get continuing education credits. We need 20 of those to continue that certification. Next screen, please. So here are some of the roles and responsibilities of a CHW. As Carolyn mentioned earlier, the social determinants of health is where we start for most of our clients or patients. Just, having that conversation that is a screening that helps us just determine what's next, helping them connect to needed resources, really looking at culturally appropriate health education and information that gives them good information to make decisions with for their life and their health. We provide informal counseling, the emphasis on informal because we're not, certified counselors, and social supports, providing resources for the healthy behaviors, however we can encourage that, what they're interested in and how we can help move forward with them for that. Language assistance is a big piece of our support. Support clinic care teams. We advocate for the individual and community needs they come up with that we can help serve them with. And a big part of our role is to collaborate with community partners. And a big piece of our skills are with our communication and ongoing development in our stigma and bias awareness, our motivational interviewing skills to really find out what the clients, what's important to them, their comfort zone, just how they want to engage for their health and how we can support that. We're working towards being very solid with our trauma-informed communications, strength-based empowerment versus shaming, and cultural awareness. We're all just working really hard to grow and become more aware of just the best way we can serve individuals. Okay, Ruby, I think we're gonna let you guide us into their client-patient stories feature piece.
And Ruby, I know that Christine's joining you. She's one of our newest community health workers. Maybe both of you could introduce yourself and then, tell us about some patient stories.
Okay, thank you, Lori. So my name is Ruby Arizmendi, and I work with our primary care department. And I am not certified yet as a community healthcare worker, but I already took the training and I'm just waiting for my certification from OHA. Yeah, and I don't know if Christina, do you want to introduce yourself?
Hi, can you guys hear me? Hello?
We can hear you, but you're moving your camera. We will see you shortly. There you are.
There you are. There I am. My name is Christina Ross. I just joined the team like a month and a half ago. I've been learning a lot.
Christina, if you want to move your camera
Sorry.
up a little bit.
Up a little bit.
There you go.
Better?
Yeah, perfect.
There you go. I just moved from Colorado. I live in Colorado for 26 years. I was a medical interpreter in a community health clinic in Colorado. So I'm really happy to learn in my new role as a community health worker how to help the underserved population. And I'm originally from Colombia, but yeah, I live in Colorado for 25 years. I think that's it.
All right, back to Mary Jo.
Yeah, I think I'll take it away with this slide. So in this photo, you'll see this is one of our impactful stories, one of the many impactful stories we've had at the clinic. So this patient was coming in to the clinic, and she had frequent emergency department visits, and this was due to her diabetes. So Ellen, that you see in this picture here, she was our previous CHW here. She helped her get into a care home and get her in a place to live and a place where she was in a good place with her health. And she has a little dog, so they were able to help her take care of her dog. And yeah, so this was one of our impactful stories from here. We miss Ellen very much. So yeah, I think you can pass it to the next slide.
Is this the slide you'd like to be on right now?
Yeah. Yeah, so this is what I do at the clinic. We currently have a program where we engage the patient with, I help them get set up with a glucometer or a scale or a phone. This is monies that we got through a FCC grant. So these are remote monitoring devices. They connect to your MyChart, and it's a very cool program. This is a picture of me here with a patient. I'm helping them set up a glucometer. So yeah, this is a great opportunity for me to use this as a time to educate the patient more about what condition they have, and also to follow up with their diabetes educator from Samaritan, or make a visit here with an RN. And yeah, pass the next slide.
I think we missed one. If we could go back just one. Thank you for that, Ruby. I think part of the exciting thing about the remote monitoring devices is that it does help the patient be able to engage in their care, have a little bit more empowerment over that. And definitely we're seeing a difference with our patients who are living with diabetes, being able to bring that A1C, some of their lab levels, down to a little bit more norms. Angela works in public health, and she wasn't able to be with us today, but she has just been a champion with the COVID tracing, and certainly her bilingual skills have been helpful. So normally she would speak to this, and then Perla is our community health worker in the maternal child health team. And I don't know if Perla's with us, Lori, are you able to speak a little bit to what the community health worker does in maternal child health?
Keep hitting the wrong unmute. Sure, Perla has been such a great addition to our team. She's really helped just bring our capacity to reach out to Spanish-speaking clients and families in a way that's just really boosted our ability to serve them and meet with them. She coordinates a lot of the care and helping the clients also learn how to access care supported with her, but also helping them take steps to obtain that kind of skill for themselves. And she's just, when she calls to talk with them, she does a social determinants of health assessment. So she can really just kind of have a chat about what's going on in their life and how, what they're looking for support. And that's kind of our initial, getting to know them and how we can really reach them and give them the best support that they can get. So she's been a delight and just really boosted our ability to give care to the population we've been missing. So that's a wonderful addition. I can't say enough about her. We want to just duplicate her about 5 more times. So
I would like to duplicate all of you. I just feel like you're all doing such impactful work, Lori. Thank you for jumping in. And then we'll move to our harm reduction health worker, and that is, I think, a couple slides down there for us. There we go, just that one. Yeah, and Cedar, are you with us today? Can you speak to what you do every single day?
Peter's here.
Thank you, Mary Jo. Most of you already know me. I'm Cedar. I'm the harm reduction worker for Lincoln County Public Health, and I use she, her, they, them pronouns. And I'm out in the community. I try to get as far as Nashville and as far as Rose Lodge and then down to Yachats as much as possible to serve the entire Lincoln County. And I go and meet people in kind of random places if they call me and say, I have mobility issues or whatever. I need services, and I drive and connect with them where they're at, literally. So that's been really helpful for a lot of folks, and just really appreciate the support from the commissioners to have this program for free disposal of sharps and giving people free supplies so they can take care of their health, and offering the navigation services to help people get into whether it's housing or if it's something like they need OHP, be able to connect with them then there and make those referrals and call up our other community health workers and say, hey, Paula, can we do this over the phone OHP enrollment? And she's like, sure, we can do that. And so those kind of connections are really important for some of the folks in our community. So really appreciate that support, and also doing the HIV and Hep C testing in the community. So COVID, of course, really impacted the ability to do a lot of services, but I've been out there continuing to meet people and provide testing and also connection to care. So that's kind of a really exciting program that's starting to happen, is the Hep C elimination project that we got some funding for, and working with Mary Jo on how to get people who might test positive with me out in the field to get confirmatory testing and treatment in our clinic. So that's another example of the coordinating care and making sure that our folks in Lincoln County can get services here instead of having to go over to the Valley to get treatment or just get into a primary care person. So that's very exciting. And yeah, our naloxone program is amazing too. It's been saving lives all over our county. So thank you for that support, and working with Jennifer Beckner and her work to make sure that not just first responders have the Narcan available, but also people who might be truly first responders, friends and family of folks that might overdose. So having that available for folks in our community, it's been life-saving for sure. Yeah, I'm not exactly sure what else to say about that. It's very helpful. Thank you so much.
Thank you.
Thank you, Cedar. And the interesting thing when this group meets, there's every patient has different challenges, different needs, different barriers that everyone in the community health worker group felt like their biggest challenge right now, and not surprising after the wildfires and the pandemic, really is housing. And I think that's followed closely by transportation. But we have had some good discussions about those barriers and some of those concerns. Just not just the availability of the housing, but some of the barriers to getting into housing and safety concerns, the immigration status. I know that Ruby had mentioned that, even just the literacy, understanding your rights as a tenant or being able to fill out the applications. There's just so many pieces that create this wall or this barrier. And it's been a difficult challenge. And I think I'm sure that the Board of Commissioners is very familiar with this challenge. We know it's not something that we're going to solve overnight, but we did have some discussions about each of these items. And I feel like we just wanted to share some of our, what the community health workers have seen out in the community as some of those barriers, kind of bringing them to life. And so we wanted to talk a little bit about the housing barrier impact, which I believe is our next slide. And I'm gonna let Cedar, Lori, Ruby, if you guys want to share some of your comments about the housing barriers. I guess I didn't even personally realize some of these. So we definitely have had some good discussion. We haven't solved the problems yet, but we have some good discussion.
Is this the slide you'd like, or do you want the previous slide?
I think we can move to this one and really just talk about some of the impacts of, the barriers as far as not being able to get into housing based on specifically some of these concerns. Cedar, do you want to make a couple comments? And then we also want to share the visual about the needle exchange and how important it is not to be using dirty needles.
Thank you. Yes, and Ruby had some really important information too, along these lines of just having accurate information around your rights as a tenant, and then types of housing that's illegal and those kinds of things. A lot of people don't have that information or that knowledge or how to talk to their landlords, and sometimes that power dynamic can be problematic when folks are required to offer things other than money to be able to live, to be able to have housing, and that's something we see in our community quite a bit. If folks are outside of societal norms, a lot of times there's a lot of shame and stigma around that, and it does become a safety issue. And just even in my small program, like our wildfire situation and the COVID situation combined, in the housing of folks that were displaced, and having those barriers to accessing shelter and being kicked out routinely of the hotels because of various reasons, but mainly because the lifestyle that they had always lived in their home was not acceptable in the culture that we are and the rules that we have for those programs. So not having a low barrier shelter was pretty hard, and there were a lot more overdoses. There were a lot more soft tissue infections, and there was a lot more probably transmission. I think we'll see more data in the future of transmission of STIs and bloodborne pathogen things, and deaths. And that, I think Samaritan could probably talk about that too, with discharging patients from the hospital and not having a place for them to go. And people did die over the winter, and that was pretty sad situation. So looking forward to hopefully in the future kind of addressing some of those needs of having low barrier and working with people, hopefully with case management or some sort of wraparound services, especially as we move forward with the eviction moratorium being lifted, and how we can support people before they find more trauma and catastrophe in their lives.
Thank you for that, Cedar. Ruby, do you want to add some comments about the housing challenges?
Yeah, I just wanted to add that with a lot of the patients that I've seen is sometimes the communication between them and the landlord isn't good. Sometimes it's especially in the last few months, I feel like some people, they try to avoid their landlord because they may owe them money and they don't want to, confrontation is hard. And so, but I think that's definitely something that needs to be worked on in the communication between the tenant and the landlord needs to be a little bit better. The other one that I was thinking about a story when Cedar was speaking about, I had a patient that he was homeless and he had 3rd-degree burns on his legs, and he didn't have a place to stay. So he had to walk from the 1010 to Fred Meyer or Walmart and get food. And so that was just a really sad story to me because, he needed a place to stay and lay down because every time he would walk, those wounds would reopen and would get stuck to his jeans. So that's just, and there's a lot of other people that are in the same situation. So yeah, I just wanted to say those.
Thank you for that, Ruby. And I know that you guys all have, I just the emotional burden for you guys with some of these stories and really trying to help people, not necessarily having all the answers, but it's kind of a nice lead in also to our next discussion that we had about transportation and transportation barriers as well. If you want to move Casey to the next slide. And looking at, we do have options to give patients taxi vouchers and bus vouchers for appointments. But, as Ruby mentioned, maybe they need to go to the grocery store, so that they can get healthy food, have that protein for that wound healing. It's a perfect example. And this last year with the COVID testing and COVID vaccinations, if somebody was symptomatic, you really didn't want them on public transportation. There's so many barriers to transportation. And then, community health workers do occasionally transport patients too. And we had to look at whether that was a safe thing to be doing or not. And, everyone wearing masks and what's appropriate for transport. I'm not familiar with Benton County's model for free transportation options, but I know it was part of our discussion when we met. And I just think we maybe, can have this discussion at a higher level and look at some of those barriers or how can we address some of those issues for both housing and transportation. And these were just some of the discussions that came up this last week or this last month's meeting, about taking the services to the patient, kind of like Cedar does. She's out in the community. She's at the 1010 clinic 1 day a week and outside the Lincoln City Clinic 1 day a week, which really has been a good connection for hopefully getting some of those patients into primary care. But, maybe looking at some mobile clinic options. There is a lot of part of the county that we don't get to. So, and I'm interested in maybe exploring or learning more about the Benton County model. I don't know if anyone has anything they can add to that. I believe that discussion point came from Paula at our meeting. Do you guys have anything that you would like to add about transportation before we wrap up?
Yeah, Those are all good points. Also, people who are struggling with alcohol or substance use and maybe are having issues on the bus and being kicked off the bus and then having to walk for long distances in poor condition. And some folks are relying on cans and being able to get to places where they can exchange cans for their income. And that's also not allowed on the bus to have bags of cans. I think you're allowed a certain number, but these things are challenging for folks in our community. And when the few services that they do qualify for, if it's being able to ride the bus to the other side of the county or whatever that might look like, when that's interrupted, that does have an effect on not just their health, but like I think on the last slide, there was a crime too, like they need to get their needs met, they need to get money somehow. And, I think that's probably part of our increase in some of these small crimes. It's just like people not being able to get their needs met.
Yes, I'd like to also add with our maternal and child health clients that there have been some, gaps in care when women aren't able to get to their OB appointments for their regular care. Maybe there's a language barrier or the money issue, or just once they get to the doctor, the appointments don't always jive with the information they've gotten. So yeah, it's a big barrier for a lot of our clients just to get to their regular OB appointments. So we're hoping we can help move forward some ideas that can really change that for our community.
All right, lots of good information. Any last comments, Mary Jo?
Just that we appreciate this time. We want to make sure we're always focusing on equity. We know one size doesn't fit all, and that we don't have all of the answers, but I think, bringing a lot of minds together and coming up with some of those solutions. And we definitely just wanted to share what the community health workers are doing and the impact they are making. Do you have questions for us?
All right, and for those that don't realize this, I do have the deck of slides, and Casey, please click on the next slide so it doesn't look like I just arbitrarily cut off conversation. I knew the next slide was questions, so questions or comments from commissioners? Commissioner Hall, I saw your microphone go first.
No questions, but I really appreciate this presentation. A lot of information to absorb and reflect on, and it just really, to me, underscores the point that for so many people in our community, community health center clients and others, that they really face multiple barriers, multiple obstacles toward obtaining care. And I appreciate the good work of our team here in working and strategizing for ways to overcome those barriers.
Commissioner Jacobson.
Yeah, I have several kind of questions and some comments. First, if Caroline Crandall is still with us, I think she is. I can't
She is.
say. So I guess I just have a question for you, Caroline. You said you were a user as a clinic, and I'm not asking you this to disclose any of your medical information, but as we go through everything about what a community health worker is and what some of our clinics do and services provided and just kind of a different framework from which they operate, I guess I would just ask you, what are some of the differences you see as a patient through these clinics as opposed to maybe other medical services you've had in the past? What feels different?
Carolyn, you're on mute.
Oh, there we go. Okay.
There you go.
Sorry. Yeah, the bottom bar disappears on me every time, so I'm sorry I have to hunt for it.
No problem.
Well, at my age, as you can imagine, I've experienced lots of different healthcare providers over the years. And the one thing that stands out to me personally about having my healthcare provided by the Lincoln Community Health Center is the time. I've never, ever felt rushed. They never say, you know, got to get on to the next patient. There's lots of questions they ask me. They give me time to answer. They ask me if I have anything else I'd like to say. The care is gentle and very, very attentive. So for me, like I say, at my age now, that's really, really important that I feel like when I go in to see a healthcare provider, that they're listening, that they care about me as a person. And that is absolutely what I'm experiencing, if that helps.
Yeah, thank you. I appreciate that. I just was wanting to get your perspective. Appreciate it. And I guess, you know, moving on down my list of kind of questions and comments, I first just wanted to do a shout out to Ruby. Ruby actually is my neighbor, or was my neighbor, grew up next door to me. And as somebody who also stayed in her community, which is kind of a rarity, a lot of people go and move off and go into other places. It's just really nice to see, you know, people that grow up here, know the community and come back here and work and give back. So really nice to have you on board, Ruby. I'm really excited to see what life in the future for you holds. And then also just a question for Cedar, and you kind of danced into this a little bit, Cedar, but just to let you take it a little further. What has the last 18 months looked like for you, Cedar, where work is concerned? Like I said, I feel like you've hinted at it a little bit, but I guess just give us what's changed for you, what's been challenging, you know, what are some of the things you've seen that maybe was different kind of pre-COVID? I think that would be helpful.
It's been really hard. It's been really hard on a lot of people, and isolating too, right? There's a lot of sadness. There's a lot of suffering for sure. And as far as our organization goes, it's been, and actually a lot of community partners, really neat to see how people are banding together. Some of the crossover with different programs. We've lost a lot of people all over, not just us, but you know, some of our partners too have lost people, and that's really challenging for sure. Yeah. There's definitely a lot more overdoses, a lot more people out there just trying to get by, I guess, you know, however they possibly can. And it's not usually a very pretty, it's sad and hard, and there's a lot of shame around it. So being able to hold space and have open arms, you know, for folks to know that we're all just having a human experience, and you know, things are hard right now. It's not going to be like this forever. This could be temporary, and you know, that we're all valuable and something to offer. I don't know if that answers your question, but it's kind of dark out there.
That answers my question.
Yeah,
appreciate it, Cedar. And I guess the last comment I just wanted to make, just to this, you know, conversation and slides about, you know, lack of resources for people and barriers, and you know, wanting to take a deep dive into these things. I think we all realize that we are living in a resource-strapped community. Otherwise, we wouldn't be facing a lot of these challenges that we have. And I think it's really easy sometimes to fall into the trap of thinking like, well, if we just had more money, you know, this issue would be solved. All we need is more bus service. All we need is, you know, to buy a hotel or whatever. I think it's easy to fall into that. It's easy to fall into that in your personal life too, right? That, you know, all your issues would be solved if you just had more resources at your disposal, but we don't have those things. Sometimes there might be temporary opportunities through grants or stuff, which then are not sustainable, which also can sometimes create more problems. But I think sometimes our best approaches to some of this stuff is kind of like ingenuity, like looking at the thing we've done forever with the same resources we've done forever and see how we can do it differently with the same amount of resources. And I think there's been some pretty interesting breakthroughs that we've made as a community, just simply looking at something different, especially looking at it with youth. I'm looking at Cedar and Ruby and all these nice, youthful faces, younger than mine, on the screen. And I think sometimes it really takes that. And so I would just suggest that, as you guys jump through trying to get through some of this, there's likely not more sustained money coming, but I think there is a big opportunity to think through how we do some of this differently with the same resources we already have. And that just seems to be in the past where there's been some really phenomenal kind of breakthroughs, not just with ourselves, but also with partners in the community. And even though, we are HHS and we have a clinic and sometimes we can be seen as competitors with Samaritan, I think this last year for them has been kind of a year, eye-opening year, to say the least. I think they've had some of the same breakthroughs and challenges that we have had. And I think that partnership, as well as some other ones, are kind of ripe for the picking in terms of thinking through how we address some of these barriers. I know that for them, especially earlier on in the pandemic, when they were one of the only testing sites available, because there wasn't testing. This is before Walgreens had testing, before you could go and pick up a test over the counter and all of that stuff. I think that they had a real painful learning process on serving, certain parts of our community, and are trying to learn from that and do things differently. So I think coming out of this, there's, perhaps just some hope that we can start thinking about how we, systematically tear apart these systems and rethink how we do them. So happy to, be a thought partner and some of that where you need me. And just a big thank you to everybody.
All right, thank you. I'll share some of my thoughts. I think, first of all, to kind of follow up where Commissioner Jacobson left off, I think the presentation really highlighted many challenges that we face, but also, as has already been said, we've developed some partnerships. And I guess the bad side of COVID is it's impacted all of our lives in many ways. The good news is, I think we do some things differently, and we've seen some partnerships and other innovations develop, which are really the first step, if you will, in addressing some of these larger issues. Second of all, you talked about the ability to access the services regardless of your financial ability. And I will tell you, I've had a few needles stuck in my arm. I got the first shingle shot before there were 2 shingle shots, and now I've got both shingle shots. When our daughter had a baby, I was told I'd better get a Tdap booster because they weren't going to let me see the baby if I didn't. And I'm fully vaccinated. I got my second Moderna shot on April 1st. And have been fully vaccinated since April 15th. So, immunizations are one form of services that I've accessed, and certainly, again, regardless of ability, I have an insurance, and my insurance pays for those immunizations. But I think that's a service that can be of value to many. Last of all, Cedar, I got to give a shout out to you. I don't know how many times I hear that Nashville is kind of the forgotten edge of Lincoln County, and you mentioned it. And I will say your comments that you've traveled to Rose Lodge, which of course is the north end, and Yahat's the south end. But Nashville's a little more remote. So appreciate the efforts that you make really to get to all parts of the county and provide some very life-saving services, frankly. So appreciate the hard work. And last, lots of different people here, but having faces that describe services and some of the outcomes is truly meaningful. So my thanks to all, and your hard work is certainly recognized and appreciated. And it's been tough times for all, but I think it's been particularly tough for our healthcare providers. So again, heartfelt thanks. And if they're Mary Jo, any last comments?
I was just gonna say thank you again for this time, for this platform.
Okay. If there are no more comments from commissioners, I'll entertain a motion.
Mr. Chair, I move that we proclaim August 8th through 14th as National Health Center Week in Lincoln County.
I will second that motion.
Moved and seconded. Any other discussion? All those in favor say aye. Aye.
Aye.
Aye.
That motion passes. And thank you all again. All right, we'll move on. Next item on our agenda is adoption of the consent calendar. These are items of a routine nature or items that have come before the Board of Commissioners previously. If a commissioner or staff member wishes to highlight an item, they may do so now. Otherwise, I'll entertain a motion to adopt the consent calendar as presented.
So moved.
Second.
All those in favor, moved and seconded. All those in favor say aye.
Aye.
I believe I heard, or at least saw Commissioner Hall's lips move. So that is unanimous and that motion passes. Thank you. We'll now move on to reports, and I guess picking up where we left off, we'll now hear an update on COVID and the vaccination activities by our interim public health director, Florence Portal. Welcome, Florence.
Thank you so much, Commissioner Hunt, and good afternoon, everybody. I wish I had better news, but the news are grim. So let's start with how we look nationally. And so this is a map that the CDC puts out that discusses the level of community transmission of COVID-19 in the country. I've made a little table to show you kind of what the colors mean. As you can see, Oregon, along with most of the country, is in the red, which signifies high community transmission, which means that we have a new case rate of more than 100 per 100,000 population. Next slide, please. Okay, so locally, I put it in red because we are in red. As you can see, our case rate. So this is our case rates per 100,000 Lincoln County from July 11th of 2021 to the end of this past week. And as you can see, our local transmission has grown exponentially, pretty much. And we're now at 169 cases, almost 170 cases per 100,000 population. And just to put things a little bit in perspective, if you remember, until May of 2021, which was 3 months ago, we had done such a great job at controlling the spread of this virus, and were moved to the low risk category. But prior to moving to the low risk category, we went into various stages, right, of risk. And where we are right now would have fallen under the high risk category at the time. And, we would have recommended that people, or asked, or required mostly, that people limit their social gatherings, that people always wear their mask, and especially in a public indoor setting. So this is the situation where we're in right now. And as you can see, the increase is steep and fast. Next slide, please. Okay, so I'm just coming back to kind of the statewide level. Unfortunately, when we put the slide together this morning, the state had not yet updated their epi curve, but you can see, I mean, from beginning of July to beginning of August, we're getting over and quite over 1,000 cases a day, and some days over 1,500 cases a day reported. Next slide, please. So this is a graph that shows you kind of like the variant prevalence over time in Oregon, and as you can see, starting in June, we started to see some, or end of May, beginning of June, we started to see some Delta variant, which is the yellow color. And as you can see now, it has pretty much taken over in terms of the main variant transmitting in Oregon at this time. Next slide, please. So I know we talked about this last week, but I thought maybe I'll remind folks, take the opportunity. So what do we know about the Delta variant? We know that it is 3 times more transmissible than early COVID-19 variant. And what does that mean? That means that earlier variants of the virus, you know, one individual could transmit the disease to about 2 to 2.5 people. This variant, one individual can transmit to 8 people. So way, way more transmissible and contagious, and way faster also at spreading. So as I showed you, it's definitely dominating in Oregon and in the country. You know, what we discussed last week is that we found out that not only we're seeing more breakthrough of vaccine breakthroughs, but also that vaccinated folks who are becoming a case can very much infect other people and transmit the virus, as well as unvaccinated cases. And we're also seeing some evidence showing that this variant increased the severity of disease. Next slide, please. And let me talk about increase the severity of disease in unvaccinated population. Okay, let me be clear, because I do not want to raise anxiety.
I was just going to ask, so
Yeah.
thank you for clarifying.
Yes, of course. So hospitalization rates, and I want to put this in context. Those hospitalizations are mostly in the unvaccinated population. Let's be very, very clear. So as you can see, we are at the beginning of August, and I mean, the curve is extremely steep and rising extremely fast. So the information that I want to give you is this. On Friday, we met with leaders at Oregon Health Authority, and pretty much they told us that this is really, really high levels of hospitalization that are really almost matching the December levels, and you can see it. It's very, very clear when you look at the surge in this past winter. What they also mentioned is that they had not seen those levels of hospitalization, especially in the ICU. So, and that definitely talks to the fact that, you know, if people need to be in the ICU, they are definitely experiencing severe disease and have needs either of ECMO or being put on ventilators. The other thing that they're talking about is that even though we're doing good in our stock of ventilators and other equipment that help people breathe when they are having difficulty doing that on their own, we are seeing some shortage in staffing. And so even though we have the equipment, we not necessarily have the staff to operate those machines. The other piece that I wanted to discuss is hospitalization locally. And so we had a meeting this morning with our Samaritan colleagues. So this is really kind of the latest number. We have 4 patients currently hospitalized in Lincoln County, which, you know, when you look at it, like put it in perspective, that doesn't seem like a lot, but for us, it's a lot. It's definitely, this is the highest. Having 4 people in the hospital at the same time for Lincoln County is pretty much at the highest level of the pandemic historically. We've been there, so this is not a good sign. Interestingly, I mean, and Good Samaritan in Corvallis is on divert, and they currently have 11 COVID patients. So what does that mean? It means like if we need to transfer, because our hospitals are critical access hospital. And so if we need to transfer a patient COVID or non-COVID related to higher level of care, right now, this patient cannot be transferred to Corvallis and will have to be transferred to other hospital system if there is space in those system and hospitals. So that's concerning. And as the Samaritan hospital system as a whole has 25 COVID patients being hospitalized currently. And this is a very high number for the system. Most of the patients are from Linn County, which has a lower vaccination rate than both Lincoln and Benton has. Next slide, please. Okay, so we've tried to trying to give you a little bit of sense. I wanted to show the hospitalizations and as I was mentioning earlier, you know, like 3, 2, 1, you know, is pretty much the max we've had, right? And we are there. So as you can see, this slide goes from end of April to this past week. Total cases 315, 6% of the cases were hospitalized. 4 were fully vaccinated out of 19. And all hospitalized people were over 40. Next slide, please.
May I ask a question from that last
Yes.
slide?
Yes.
Thank you, Casey. So of all persons, you know, hospitalized, are those all unvaccinated individuals? Do we know?
So as you can see, we have 19 hospitalized. 4 of them were vaccinated.
Oh,
so the
okay.
rest is 15%. So
Sorry, I was not reading that correctly.
No,
All right,
it's-
thank you
it's
for the
okay.
clarification. Got it. Thank you.
So about 80% of the people who have been hospitalized were unvaccinated.
So Florence, since we've kind of paused here, I would ask for clarification on how many people are in the hospital now, COVID related in the hospital.
4.
Are they in ICU? Well, you can answer me later,
I don't know, I can.
because I think the county only has 20 ICU beds, and if you know, you've got 4, that's
So for sure,
20%.
we have 2 in the ICU at PCH, and she didn't have the numbers for, I mean, we have 2 in North Lincoln, but she didn't know if they were in ICU.
okay. All right.
What was mentioned this morning is that, yes, we don't have many beds, but we have some flexibility, if you may, in using other beds if needed. But
Okay.
yes, this is definitely not a lot of bed available.
Okay, thank you.
You're welcome. Next slide, please. Okay, so this is telling, look at this, look at the upper graph. July, 103 cases. August, we're 9th of August. 110 cases. This morning, 40 cases reported to us. The team, as you can imagine, is underwater. We have been able to recruit 3 people, four people to help us with case investigation. We are also pulling some staff out of their normal duty to help jump in, because this is, and we are in surge investigation mode, which means that, you know, the questions we ask, we don't go as deep in the questions so that we can move through the investigation and the interview a little bit faster. And also, we're not required to really open outbreaks for any situation that is not a congregate setting, okay? I also want to point out that there is a typo on the slide. The number of hospitalization to date is 82, not 73.
So Florence, this 110 is before the 60 that were reported this morning?
No, that includes the 40 that were reported.
40, okay.
Mm-hmm. But I mean, 40 is.
No.
I don't think like it. I think it's unheard of, to tell you the truth.
Well,
I mean,
obviously, I'm
unheard of in
thinking
Lincoln
worse. I'm
County.
thinking 60 instead of 40. So.
Right. No, and outside of the very large outbreak we had last summer, this is pretty high for us.
Okay. Thank you.
Okay. Yeah, you're welcome. And like you can, as you can see on the graph, August cases are already 7% higher than July's total. Next slide, please. Okay, so this is to give you a sense of what our own AP curve is doing, and you know, logically, it's, you know, increasing really, really quickly. So this is pretty much each day, each little bar is the number of cases that were reported to us, like through, you know, the lab results and things like this. And as you can see, it's going. We're having a dramatic epidemic expansion in the past months. You know, and this is definitely likely due to a variant that is 3 times more transmissible. The fact that at the end of June, you know, the executive orders were rescinded and the mask mandate went away. And so now nobody is wearing a mask anymore. So the virus is very much spreading, and, you know, people are gathering, having a good time, maybe not necessarily keeping their distance with each other. And then this is what happens. Next slide. So this is a slide, same thing. The idea is not to make people nervous. The idea is to show what is happening, okay? So as you can see, prior to Delta becoming the dominant variant in Oregon, we had here and there a few reports of breakthrough cases. Since June, as you can see, you know, we're seeing more breakthrough cases. I mean, the percentage of breakthrough cases is pretty much between 20 and 25% of all the report, what we've seen, you know, lately. So this is concerning, and this is why we are recommending, and thank you very much for your recommendation last week. This is why we're recommending that people mask at all times when they are in a public indoor setting outside of their household, very much so. Because so a few things. Delta is able to break through and create more infections in the vaccinated population. However, Delta is not very good at fighting the vaccine when it comes to severe disease, hospitalization, and death. So the vaccines that we have available to us have been extremely good at keeping their efficacy against severe disease, hospitalization, and death. So it's very good news. So we might get sick, but we might not get very, very sick. Okay. Next slide, please. Okay, so this is a little bit more detail as to what we've seen so far, you know. And the cases so far in August, this is because this was pulled until Saturday. And so a few cases were added. We're seeing what the majority of cases between 19 to 54. See, fully vaccinated is about 23%. Next slide, please. So I thought I would talk to folks a little bit about a few things to kind of keep in mind, right? So regardless of your vaccination status, if you test positive for COVID-19, you will need to isolate for at least 10 days, okay? Now, if you are a contact of a COVID case, you were exposed to your friend, whatever, what public health would ask you to do is going to be very different depending on your vaccination status. So if you're fully vaccinated at the time of exposure to the COVID case, you won't have to quarantine. I mean, we would recommend that if you can quarantine, please do so, because we know you can transmit if you were to be infected yourself. However, you're not required to do that. What we ask is that you wear a mask and that you monitor for symptoms for 14 days. And that if you can, that you go get tested a few days after your exposure. I know it's a lot. If you're not vaccinated or not fully vaccinated, then we will ask you to quarantine. And the other piece is that if you're quarantining at home and you have other people in your house, you know, wearing a mask around all those other people, especially if they're not vaccinated themselves, is probably a good idea so that you can protect them. Next slide, please. So this is a little kind of graph or drawing of what it means, the difference between isolation and quarantine. So pretty much isolation is you're sick and you want to stay away from other people. Quarantining is that you're not sick, you were exposed, you might want to wear a mask so that in case you become sick, you're not transmitting to other people. Next slide. Okay, so I know people are wondering, like, where can I get tested? A few things. So we have plenty of opportunity in the community. Walgreens, from what we're hearing, if you want to be tested at Walgreens, you might go there early in the morning because otherwise I don't think they have a lot of capacity at this time. There is capacity at the Celeste Community Health Clinic, some of the Samaritan clinics, and this is if you are a patient or an established patient of those clinics. Then of course, like we heard earlier, Lincoln Community Health Center in Newport is offering testing, Samaritan Walk-In is offering testing, and then we have had some free testing events through the University of Oregon. There are more resources on our website. I've put the link on the table. We're working with Samaritan to possibly offer a dedicated testing location. So more to come, and I will let you know as soon as we put this together. Next slide, please. Okay, so if you were still asking yourself, what can I do to protect myself and my community? One, go get a vaccine. We have plenty of vaccines. And all of those locations that I mentioned earlier have vaccines available. There is vaccines at all pharmacies. We're doing mobile clinics also in various locations in the community. This is the best tool we have available to us to try to curb that rise in cases and protect ourselves, and also try to stop this virus from mutating and becoming more resistant to the vaccine. The second piece, if you're already vaccinated, or let's say you can't get vaccinated, please wear your mask. Please wear your mask. So, you know, sometimes I hear people saying, well, but even if I wear my mask, you know, this is not 100%, it's not 100% guarantee. No, it's not. Let's be clear here. Vaccine, not 100% guarantee. Very, very good, not 100%. Mask, not 100% guarantee. Get a vaccine, wear a mask, you're just adding on layers of protections. So, so we're all in this together. You know, some people really have a hard time with masking. I understand it. And this is the only way we're gonna curb this, because we are at, like I showed earlier, we are at a point where we were having a serious epidemic this winter, and we had a mask mandate at the time. So this is concerning. Next slide, please. We'll try to end on a positive note. So our vaccinations, we're doing really good, and we can do better. You know, we've done a really good job, but you can see also how much like the vaccinations have dropped. We might see a slight increase in vaccination, but we're pretty much plateauing at this time, and this is unfortunate. Next slide, please. Okay, so this is showing you like how many, and the data is, I was told earlier that there is a typo, so the data is as of 8/6, so as of last Friday. 32,000 plus of us have been vaccinated. Wonderful, 74% of those of us who are eligible. But as you can see, last week we had a 1 point increase. This week it's less. So I'm just hoping that people are gonna really see and have this sense of urgency around you know, using the tools we have to protect ourselves and our communities and really get rid of this thing. Next slide, please. So here's our kind of traditional slide for our vaccination by zip code. You know, we're seeing some progress. We still have areas where we're lagging a little bit. We're lagging behind, but we're seeing some positive movement and some increase in uptake. So we'll keep on going. Here are all the clinics that are going to be targeted in those areas. Siletz City Hall, Siletz River Summer Cruise, Panther Creek Community Center, Toledo Waterfront Market, Toledo Swap Meet. Tomorrow we have an event at the Rogue Brewery in Newport, La Juquelita, Oregon Coast Community College, County Courthouse, and the Aquarium. So the team is busy. We're thinking about maybe offering some testing as well. We have a few logistical steps to take prior to being able to do this, but we're working to we're working hard. All right, this is what I have. Any questions?
Questions or comments, commissioners?
I will just repeat what I said in an email to Director Romero earlier today when she sent me an email saying we had 40 positive cases over the weekend. And I think my comment and typing was something like, wowza. I mean, we were, you know, I just want to remind everybody to get vaccinated. I mean, you know, cases are going up and that's one thing, but you get a vaccine and it's very unlikely you're going to die. And, you know, we all get illnesses all the time. It's the dying part that I think we all want to avoid doing. And I will also say with schools opening up just around the corner and most children are not eligible, well, kids under 12 are not eligible yet. I just really would hate to see that get jeopardized for in-person learning this year. So that's my dark comments, I guess, following on Cedar's words from earlier.
Thank you, Commissioner Jacobson. Commissioner Hall?
Sobering numbers, alarming numbers, and I hate to imagine where we'd be right now if we didn't have 74% of the eligible population vaccinated. Florence, thank you for bringing us the news unvarnished and for the continued good work of your team. Something that I'd like to just put before the board right now. I've had a handful of people appeal to me, and I don't know if you've heard from anyone asking us to reimpose a mask mandate. We did a mask recommendation last week. Now, a year ago, when we first were looking at acting before the governor stepped in with first selective county mask mandates and then a statewide mandate, we were told that we didn't have the legal authority to do an enforceable mandate. However, I did see a news story come out this afternoon that the chair of the Multnomah County Commission has now issued an executive order mandating indoor masking in public spaces with a potential fine of up to $1,000 for violation. Now, I know that Multnomah County is a home rule county and we are not, so perhaps their board and board chair have different powers, but I think we should at least investigate this issue further.
I would agree that we need to investigate the issue further. I think, as Commissioner Jacobson has said, vaccinations, clearly the science is there that vaccinations prevent the serious illness, certainly slow the spread of the disease, and vaccinations with masks are clearly the most effective way to limit the spread. I think there are some legal questions. Commissioner Hall, I think you noted one of the differences between Multnomah County and our county, but I think it's certainly appropriate to have additional discussion as to what we might do to try to further slow, which is quite frankly a frightening situation with the rate of increases that we're seeing. So I think I'll have some discussion with our legal staff and see what additional options might be available to try to further address the concerns and the increases. Commissioner Jacobson?
I just want to weigh in as well and say that while I certainly, don't want to overflow our hospital capacity, which has been the big fear, all along from the very beginning of the pandemic, was having a scene like that unfolded in New York or Italy, or even later on with the Delta variant in India. I mean, that's what we're all trying to avoid here. I have similar concerns about enforcement of a local mask order, as we just don't have the teeth that the state would have. We don't have OSHA, for example, which was enforcing those rules. But beyond enforcement, it's the compliance piece that I'm kind of worried about here. I feel like people that took this thing seriously from the beginning, wore masks, got vaccinated. Those are the people that I'm hearing from. I think the people that want a mask order again, I think the people that for the most part are largely unvaccinated, who we most worry about, I don't think they'd follow a mask order. Even before the state order was taken away, there was a really big, movement called Unmask Oregon. If you want to scare yourself, go look it up. With lots of people, even in this county, actively defying mask orders. And that was a big, if you could get away with it, that was a big, thing on your belt buckle. Yay, I did it. And And I have a feeling that we would see more and more in that. And I'm not sure it would actually get us to the results we want. So it's not that I'm against people masking themselves. I am going back to wearing masks in grocery stores as of last week. So that's the personal choice I have made. I just don't know if another mask order would actually get us the goal we're trying to accomplish. And that's what I'm a little bit worried right now. It's just compliance. But I think talking to legal and seeing what an option is would be helpful.
Well, I think that's certainly the critical question. And as I said, I think we should have some conversation and see what we might be able to do to help address the rapid rise. And enforcement is certainly a critical part of what we might decide. But I think additional discussion, I think we're all in agreement that additional discussion is warranted. So the last thing I will say is, Florence, that was a brutal presentation, but frankly, I think it needed to be. There are some serious challenges out there, and the harsher the message, maybe the more receptive people will be. So
yeah, I'm sorry. I just presented what we're seeing.
no,
you know, right now.
It wasn't a criticism, it's a reality.
Yeah.
All right. Anything else, commissioners? I'm going to make a decision as chair, and this meeting has been running very long, but so far we've been on health. Rather than go to the fire update, I'm going to jump to the next two items on our agenda and then come back to the fire update, if that's acceptable to my fellow commissioners. All right, with that, we'll move to the Economic Development Alliance update. Thank you for your patience, and welcome to the meeting.
And thank you very much. And Yowza, it's kind of tough to follow that, but wear your mask, absolutely. Though it was good over the lunch hour seeing people in the shopping stores, lots of people are masking up, so that's good. Yeah, thanks very much for having us here today. And I'm Paul Skidema, Executive Director of the Economic Development Alliance. And I'm joined with my wingman today, Bob Cowan, Director of the Hatfield Marine Science Center. And he's a member of our board of directors and our executive committee. And we're very much looking forward to giving you an update. I shared with the commissioners through Christy our operational overview. We don't need to spend time on that, but that's a good baseline to get a sense of what we've been up to, and also what's on our radar in the short term. So it's just a good reference stock. But kind of looking back over the past year, a good deal of my initial time was spent building my network and understanding our local economic ecosystem and trying to get a solid and realistic sense of what's needed now and in the years to come with Lincoln County economic development and also regional economic development. And we've got some great opportunities and we have a lot of work to do. And I want to start off by saying I really look forward to collaborating in the future with Lincoln County. And I honestly believe that our goals to this end are fully aligned. So I'm looking forward to the work we'll do together down the road. So I want to hit on just a couple highlights over the past year, not any laundry list or anything like that. But one project that I'm extremely proud of is the redesignation of our countywide enterprise zone. And you probably saw the emails come through late last week, but we are now officially redesignated by the state of Oregon with the retroactive start date of July 1st of this year. And that was a challenging process. We've been working pretty much full time on that since late March. And we have one of the three most complicated zones in the state, but we ended up getting all of our sponsors back on board with unanimous support votes across the county. And I want to thank the commissioners and also the GIS department at the county for helping us make that happen. And this is a very powerful incentive for business expansion and attraction, though it really hasn't been effectively marketed in the past. And I plan to make sure we get the word out on this incentive going forward. Just kind of looking over the past year in the enterprise zone, the two primary projects utilizing it now have created roughly 35 new living wage jobs, full-time jobs, over the last year. But I think we can do a lot better. And I'm really looking forward to having that tool in our Swiss Army knife going forward. I'm also really proud to have worked with very actively with the Cascades West Economic Development District as they develop their new comprehensive economic development strategy. That's a required document for economic development districts, and alignment with that is one of the scoring criteria for any EDA projects going forward. And I also have the pleasure to serve in a small team that's putting together a regional implementation workshop that we'll be running on September 30th to take the steps needed to make sure that this plan gets enacted on and doesn't just gather dust on a shelf going forward. Though I don't know if you could say gathering dust on a shelf if it's a PDF. Is that like the bits and bytes are decaying? I don't know. And I'm also selfishly, and also for our region, very proud of the new online home for EDALC at businesslincolncounty.com. If you haven't had a chance to swing by there, check it out, because the website is an important tool in business attraction going forward. And I'd love the commissioners to take a look at the county profile on there and see if it captures, if it passes your gut test, to see if that captures the real aspects of our community, or if you have any suggestions or thoughts on that. And we've also done quite a bit of project work over the last year, such as working with the Art Toledo Committee on their efforts to utilize the creative economies to revitalize Main Street. That's been awesome. And we were also working with Lincoln City on business attraction. We helped them with some of the writing and planning work on their amazing new attraction piece. And we're also putting together an action plan for business recruitment once a lead is generated. So once they get their tool out there and the call comes in, we can help them move forward and close that deal. And, one of the things that I love about this job is collaboration, pulling people together and working on a shared goal. And one of the interesting things that we've done over the last couple months is we were able to work and pull a coalition together to put together a response, actually two responses, because we made it through a couple rounds, from an RFI that came in from Business Oregon for a potential $90 million investment in the county. And we pulled folks together all over from government, county, Hatfield, OSU, to really make a compelling case and a pitch for our little corner of the coast. And we're still waiting to see if we can land that whale. And we've also partnered with local stakeholders to come together and convene when developers have been looking to invest several times in the purchase of large-scale businesses in Lincoln County. From Representative Gomberg, Senator Anderson, municipal officials, SBDC. I think we do a really good job coming together and helping those potential investors feel like they're supported if they're coming here. And that's really awesome. And I see us doing a lot more of that. So just shifting gears to some current work that we're doing. One of the things that I'm very excited about, we're working with Melissa Murphy of Business Oregon and some local stakeholders to pull together an application for Business Oregon's Rural Opportunity Initiative. It's a 3-tier, 6-year program to help a region develop a scaffolding and the projects and the local knowledge to grow a region's entrepreneurial ecosystem. And that RFP will drop either sometime before 5 o'clock today or tomorrow. And we're getting ready to dive into that program and get that in place here locally. And we also received 2 Cascades West Economic Development District resiliency grants over the last month. One project in partnership with the City of Toledo, thank you Toledo folks, is to develop a commercial property database of both for sale and for lease commercial property across the county, not just Toledo, but across the whole county, utilizing the Oregon Prospector tool, which is the nationally available tool that the state has specifically for commercial property research and for site selectors. And it'll be a tool that I think we could use locally very effectively, because I spend a lot of time, I know Dave Price spends some time, the chamber spent a lot of time trying to help businesses find commercial space to lease. And it's harder than it should be. That information is tough to pull together. And we also got a grant to work in partnership with the city of Newport on a web tool to allow multiple organizations to publicly share their plans of work, strategic plans, and projects. And we're developing a first of its kind WordPress plugin, and we hope to eventually expand that into the Ford Family Foundation's community website program. So that's kind of cool to be leading on that front. And as you know, we're also actively involved in the Oregon Ocean Innovation Hub. And last week had a presentation at our board meeting to start the brainstorming process and how we can best help O2IH launch in the most impactful way possible. And one of the most important, I think, future projects that I see is developing a county-wide economic development strategic plan of work. It's something that we feel it's essential, and we'd love the support of the county on this. In fact, I think we need it. I'm not talking an organizational plan for EDALC, but a future thinking roadmap of multi-organizational work that needs to be done. And it's an opportunity to move from priority discovery, which has been done, and as recently as working with Commissioner Hunt on the listening sessions last November, but moving to really implementing a plan of work across the whole county, and something I'm really passionate about. And I'll just wrap up with just a couple comments to give time for questions on our organizational funding, because setting up a long-term sustainable funding model for us as an economic development organization it's a key priority of ours. And what that looks like is an approach that we put together last fall. And essentially, any countywide economic development organization, us or someone else here on the rural coast, needs to look at three legs to make that funding stool stand and not wobble. And that's public sector funding, private sector funding, and grant funding. And because of the way our local economy works, we don't have enough traded sector companies here to be fully private sector funded, as a lot of more urban EDOs are. So in an ideal world, just so you know where we want to go, we're looking towards a diversified public sector funding with hopefully the county as lead, with other municipalities supporting at per capita levels for fairness. And that ROI program from Business Oregon, the Rural Opportunity Initiative, can be a great on-ramp to that municipal funding. It's a great place to start. Toledo, Lincoln City, Newport were in those conversations that we had about a week or two ago with Melissa. So there's a great on-ramp to make that start to happen. And we're also working to enhance private sector funding, growing our membership base, and adding several more impactful support tiers for larger companies. And finally, looking at grant funding for specific project works and to grow capacity in certain areas. And I guess the last thing I'll say on this front is I firmly believe that if we do receive any public sector funds in the future from Lincoln County, we should also set up together a service agreement so that we can all be very clear on the deliverables and expectations. I think that's just makes good sense. And obviously a top priority for EDALC is long-term recovery and resiliency. And that work on the economic development front, that's going to take some time. I mean, we're going to be in this recovery mode in the business sector for probably 18 months minimum, probably longer than that. So I'll pause for a moment and ask Bob, is there anything I forgot? Anything you want me to add? Anything you want to add to that?
No, I think you gave a good overview. I will say that it's been really useful. Lincoln County has encouraged EDALC to rethink, to look at what our activities are and what role we have in the county's economic development. And I think that's been really useful in this last year. We've been reflecting, networking, as Paul mentioned, planning, working towards both a strategic plan for EDALC, but also the goals of really how the whole county proceeds with economic development. There are a lot of recovery resources out there for economic activities, and we need to be primed to, as a whole county, to take advantage of them. And I think I do feel that some of the trajectory that we're moving towards writ large actually does suggest sort of a brighter future with regard to a more resilient economy here. And as a member of the board, I'm pretty excited about the diversity of projects that we're talking about, how so many different portions of our economic sectors can take advantage of it. So anyway, I'm encouraged as we go forward with this.
Excellent. Thanks, Bob. And are any questions or comments from the commissioners?
Just for the record, note that Bob is Dr. Cowan, who is the director of the Hatfield Marine Science Center and also a member of the EDAC board.
Thank you.
Commissioners, questions, comments? Commissioner Jacobson.
Yeah, I do have a couple of questions. The first one is back from the very beginning of your presentation. Sorry, Paul, you said that of the economic zones that you were working on, that ours is one of the more complicated ones in the state. And I was just curious why that was.
A lot of the zones are very compressed in that only maybe have 2 or 3 taxing bodies as sponsors of the zone. We have 8 different taxing bodies as sponsors of our zone. And then we have all of those other mini taxing bodies, the fire districts and things like that. So aligning 8 sets of resolutions is a challenge. And I think there's one other enterprise zone that has 9 sponsors, but we have 8. And so I'm pretty pleased that we were able to punch that through.
I always say it's like herding cats, and then I usually get beat up in the media for it, but that's often what it feels like, is herding cats sometimes on some of these projects.
Yep.
I guess the other question I had is about a couple of weeks ago, and actually I'm not sure if you received the same document or not, but there is a private economic consultant that does some work for the Oregon Department of Fish and Wildlife every year, mostly honing in on the contribution to the from the commercial fishing industry into the community. And but the numbers they provide kind of give a general overview beyond commercial fishing. And a couple of things I thought that was interesting about that is one, and some of this we already know, but in terms of sources of income, about 27% were transfers, people mostly retiring and coming here and bringing their money with them. About 23% was investments. Of earned income, which is about half, commercial fishing was 9.9%, tourism was 8%, timber was 6.2%. You're going to like this one, Dr. Cowan. Marine science actually made the chart this year at 3.7%. So that was exciting to see it broken out in its own little category. And then kind of not identified sectors, 16.7, and other identified sectors 86.5. So that's all the other kind of businesses and stuff kind of shoved together. So I guess my question is, you're, relatively new here. You're kind of still maybe have a little bit of that outside perspective looking in. Where do you see some real opportunities we have for business development? And I will say, I think we're hamstrung right now with housing and childcare. I mean, I just don't think we actually are very competitive because of those issues right now. But if those weren't issues, and if those weren't very big barriers, or if those became solved, where do you see some opportunity?
I mean, I think a couple areas where I see some opportunities, and let's say maybe not housing solved, but maybe there's some lower hanging fruit. One thing that I think is a good direction, and I know Lincoln City is very intentionally moving in this direction, is opportunities to either attract or start up some businesses that service the visitors here, the tourists here, but they can stretch out their stays, not to bring necessarily more people here on a weekend, but try to get those stays to be, 3 to 4 days, and to maximize the stock that we've got. And those, could be along, rainy day attractions like, Ripley's that we've got in Newport and things like that. I think that's one opportunity. I think the other two opportunities that might be sooner rather than later, because they're not so huge as far as number of people and they pay very well, is one, looking at, are there ways that we can attract or incentivize some businesses that do some development work in software, web development, whether it's app development, things like that, that could be smaller teams, 1 to 3 to 4 people, that generally are quite high paying jobs, that those can't fit everywhere in the county because we don't have the middle mile broadband everywhere, but there's certainly some opportunities there. And the other is looking at small scale high-tech manufacturing, and a poster child for that is the small company in Toledo that makes the grounding strips for the SpaceX rockets. I mean, that is a company that has, I think it's 6 or 7 employees. That's it. They operate out of a very small facility, but sell things that can be shipped by UPS or FedEx. They don't need a transportation infrastructure. So there's not that much burden on our housing system. There's not that much burden on our transportation system. But there's an opportunity there for some high wealth jobs. And so I think that's where I would probably start, and looking at, are there clusters in the region or in Oregon or on the Pacific Northwest where some of that small scale manufacturing to support those clusters could be attracted here.
You're muted, Commissioner Jacobs.
Yeah, sorry about that. Yeah, thanks, Paul. Appreciate the insight.
Cool.
Commissioner Hall.
I don't have questions, but just a couple of observations. I really appreciate the presentation. I really appreciate this document, the operational overview. It looks like you've got a pretty clear and focused work plan for the year ahead, and also am very pleased with the discussion and moving forward, moving the organization forward strategically to pursue more diversified funding, and to whatever degree is possible, public-private partnership. You know, I've been around long enough to recall when the Alliance was originally created 27 years ago, and that was part of the original vision, but it just seemed to get lost along the way in the decades since. So glad you're taking that back up as well. Thank you.
Excellent.
I'll offer a couple of comments. First of all, I think we all agree that economic development is a critical part of our county, critical part of the state. You know, you're either moving forward or you're moving backwards, because you can't tread water forever. Again, I think economic development is a critical part of the county. I think that the efforts to reinvigorate the way the Alliance is looking at economic development is certainly positive. And I thank you for your involvement in the Economic Development Community Improvement Grant process. That certainly is one of the ways that we're able to support economic development in the county. And finally, I'll echo Commissioner Hall's comments. It's nice to hear the efforts to try to diversify the funding for the Alliance. I think that's a critical step. So with that, any other last minute comments or questions?
I mean, do we there's like another item on the agenda, on our little agenda chunk, which is talking about the next round of the Community and Economic Development Grant Program. Do we want to move into that? Commissioner Jacobson, do you want to take the lead on what you were thinking of there?
Sure, I can tell you, Paul and I, along with some office staff that help run that program, had a conversation about possibly just re-envisioning that grant process a little bit. Again, this is the Community and Economic Development Grants. As it's been referred earlier in the presentation today, Commissioner Hunt worked on having kind of these listening sessions done, looking at what our constituents want in terms of economic development. And the three major things that rose up in that process was childcare, broadband, and housing. And so our kind of, as Paul and I kind of batted around ideas, one of the things we thought about is to pull out about 60K out of that proposal. I shouldn't really say pull it out, maybe put it aside is kind of a better way of wording that. So put 60K aside, and that 60K would be really focused on funding one large project in that childcare, broadband, or housing piece. The Alliance could still take the lead in weeding through those applications, but likely, given the expertise involved on doing those proposals and considering it's a much larger investment, may need to source some of those reviews out to other experts outside of the county, just like you would do for an academic proposal. You'd have other reviewers review those from other places that do similar projects. And then the rest of the money, we would go through our kind of normal, in quotes, process for community and economic development projects. So we still would have funding opportunities for kind of those smaller economic and community development projects, but then also fund, if there was a project that came through, still fund one kind of larger project and really trying to target that to that broadband, childcare, or housing project. So that was the idea that Paul and I and staff kind of batted around.
And I guess I would just add one thing, and we also talked about starting back up again, doing like an hour-long, probably early September, little grant workshop. And I talked with Dave at the SBDC that we could run that through them, but basically to kind of talk through the changes in the program, give them some advice, some of the organizations some advice, have an opportunity for dialogue, and also give a little tick to some folks who go through that to get a little advantage on the scoring, just to make it so that we hopefully get some more informed applications coming through. But other than that, I think it's great. And our board totally supports that shifting. I think that would be, of some funds to a single impactful project, in addition to a few less of the standard projects. I think that would be great.
Commissioner Hall, comments, questions?
It's an intriguing idea that I'd sure be willing to look at further.
Yeah, I think this is an area that I've mentioned several times in prior years. In addition to creating the opportunity, if you will, for a bigger project, I continue to hope that we can tweak the system, if you will, so that the economic development aspect of these grants get maybe a sharper focus versus community improvement. And then the last thing I'd say is I'd like to see some, I'm not sure if limitation is the right word, but frequency of awards. When you have the same project that's this week we're putting in this year we're putting in sidewalks, and next year we're putting in door frames, and then the following year we're putting in windows. I'd like to see something that maybe says funding 2 out of 3 years in an effort to really diversify the ability of others to access this program, which I think would give it greater value. So those would be some of my thoughts, but I'm certainly supportive of some kind of a process by which there is a single larger project identified. With that, any other questions or comments? Does that provide some clarity to you, Paul, or Dr. Cowan?
Yep, it sure. And on the grant program, is there some next steps that you want us to take? Do you guys want to take that on your plate? What do you think as far as the discussion?
Commissioner Jacobson?
Yeah, I would kind of suggest that maybe with the feedback you've gotten, Paul, maybe you want to take a stab at kind of writing it up, what it's going to look like. So I would say almost write it up as if you were sending it to an applicant. You know, and Chrissy Peter may be able to work with you as well, since she's the one that actually does send it to the applicant. She would probably enjoy being included in that process. And we send that back around to all of us so we can, you know, look at that and review and discuss further if needed. I do know that is kind of right around the corner, so it is probably something we need to, you know, get a draft out and review. Also, changes can be systematic over time. They don't all have to be at once, but I think if you maybe want to summarize all of that and kind of put it together, I think that would be helpful.
Absolutely. Consider it on my to-do list.
Thanks, Paul.
And thank you all so much for the time and the opportunity to come before you today.
Thank you.
Thank you. All right, we'll move on to the, well, it's a resolution I believe we'll be discussing the approval of the Toledo Urban Renewal Plan. I believe this is coming before us because it involves a slice of unincorporated property in the unincorporated area of the county that the county has a right of way. So it's not all city property, therefore it requires our approval. But I'll let the presenters correct me or enlighten me, and welcome to the meeting. Thank you for your patience. And I'll let either Judy or Elaine go first.
Elaine, would you like to go first?
I can go first, or Mayor Cross, would you rather?
Well, I should have recognized the mayor. My apologies.
Yeah, let's let the mayor set the stage and we'll go from there.
I'm just going to say that as all things are with, how shall I say this, map making anymore, you find more and more errors as things go on, and some errors came to light and we needed to get those corrected. And that's why this particular item has been brought to you. One of the other reasons why we would like the county's approval on this is because as part of urban renewal agencies, if any work is being done on public buildings, that the affected taxing agencies need to, 3 of the 4 in this case, need to agree to it. And we would be working on a public safety building and rewiring our 1934 City Hall and attempting to bring it out of those eras of electricity, as it were. Elaine or Judy, you can give better specifics than I can, so take it away.
Hi, I am Elaine Howard. I am a consultant who works on urban renewal plans and have worked on many in Lincoln County. I worked on the last Roads End one with Allison in Lincoln City, and I've worked on the Newport one. So I'm very familiar with Lincoln County, and we are appreciative of your time today. As the mayor indicated, and if you, I think you have my PowerPoint, a brief PowerPoint on here. I saw it come up and when the last presentation was being made.
Yeah, it's part of the board packet.
Yes, so if we can pull that up, I can walk through that quickly, and I don't think I can.
Easy.
Yeah,
there we go.
Next slide, please. So I'm just going to give a little background, talk about the boundary and the projects, the financing and the timeline. Next slide.
Is that a picture of Toledo?
It is. Oh, the last one?
Yeah.
The first one was.
Okay.
I have my own backgrounds in my slides from other urban renewal areas where I've worked. So I kind of developed my own set of slides. So the first one was Toledo specific.
1 out of 2 isn't bad.
That's great. So the role of Lincoln County today, is to decide whether to also approve the Toledo Urban Renewal Plan due to unincorporated properties within the boundary. As the mayor indicated, we have one property that I can show you when we get to the boundary that seems not to be linked to the rest of the city through a right-of-way. And we didn't figure that out until we ran our legal description by your county assessor staff, and they were very helpful and pointed that out to us. And so we then decided we need to figure out how to solve that. We also are required to brief the county on any new urban renewal plan. The county typically doesn't have to vote on the plan. In this one, we will need a vote of you or your board, or we will have to change their plan. There is also the issue that the mayor brought up of the public building. We have been working with, we have to get 3 of the 4 taxing jurisdictions. We've been working with the city, the greater Toledo Pool, and the school district, which are 3 of the 4 on that approval of the public buildings in the plan. So we had not anticipated having to ask you to do that. So if you would like to give that approval, it would be great. We are hoping we will get the approval from those other 3 districts, so you wouldn't have to give that specific approval. Next slide. This is the potential urban renewal area boundary. It's 327 acres, and it does conform to the percentage of acreage within the city limits for urban renewal. You can see where the blue arrow is at the top of the slide. That particular parcel is not tied by right-of-way to the rest of the parcels within the urban renewal area. And so the reason we have to get your approval is to be able to have that property within our urban renewal area. We do want it within the urban renewal area. Our option is to remove it now, annex that right of way, and put it back in the future. That's much more cumbersome. We would rather do it this way if possible. You can see the rest of the urban renewal area goes down and through the access to the city off of Highway 20, takes in the downtown area and goes over to the industrial properties across the waterway. Next slide. This does meet the requirements for both acreage and assessed value. The acreage is 20% of the city's acreage. The assessed value would be 9.71% of the city's assessed value. Next slide. These are the projects in the plan, and I won't go through every single bullet point, but just the main parts. And then if you have questions, we can go back to them. But as you know, in downtown Toledo, there are many buildings that are in need of improvements, where there are either vacant storefronts. It seems about every 1 in 4, maybe more, of their buildings on the ground floor are not occupied, or the upper stories are not occupied. There are many buildings that have needs to upgrade. So the exterior doesn't look good. It's probably not safe. So being able to help provide building improvements within their area is a very important part of their plan. Next slide. Public buildings, these are the 2 public buildings for which they need the approval of 3 of the 4 taxing districts. The current public safety building is in the flood zone area. It is too small for the needs of the personnel who use that facility. The city has purchased another building that is up out of the flood zone, and they would like to relocate the public safety building out of the flood zone and up to the other facility. And as the mayor said, the existing city hall needs the wiring updated and other kind of basic improvements to maintain that building and keep it functional for the city. Next slide. To the city of Toledo, the recreation improvements were very important, and I think it's because they are a community that is very focused on their families and the needs of the families within their community and providing opportunities to those families to flourish. So a number of the improvements are helping to stabilize and keep that existing residential community intact. So Arcadia Park facilities, working with the pool district, hoping for a new community center in the future, and then improvements for recreation. And we should have taken that word port out of that bullet point. So just other improvements for recreation. Next slide, please. Utility infrastructure is always important in an urban renewal area, and it is the same in Toledo. They have needs in their sewer system to improve some of the sewer manhole liners, sewer manholes by installing liners, to reline section of the North Main Street sewer line, to work on other sewer system projects. The water system has upgrades that are needed to the water meters and replacing sections of the water main from Northwest 5th Street at Business 20 to French Street. And then their wastewater system needs a new lift station at A Street to replace the existing station that's nearing the end of its life expectancy. Next slide. Pedestrian improvements within the area to connect both the commercial districts to other parts of the city. So installing a walkway from Northwest I Street to Business 20, removing overgrown trees that are in the downtown and replacing those with trees that won't cause the bulging problem that those trees are presently causing, and to repair those sidewalks, to install a sidewalk from the Port of Toledo offices to Ridge Drive, and to install benches, planters, and family-friendly activity trail along Main Street and Business 20. Next slide. As in most urban renewal plans, there are categories for both acquisition and disposition. If they ever decide to purchase property, that property will have to be put into the plan through a minor amendment. And then just an administration line item to allow for funding to administer the urban renewal area. Next slide, please. This shows the capacity of the area and the proposed maximum indebtedness. The maximum indebtedness of an urban renewal area is the amount of funding that may be used in the area over time. So over in this area, a 32-year time frame, that maximum indebtedness is $31,300,000. When you reduce that to present value, that is $18,200,000 worth of projects. As in all urban renewal, the early years are lean because the growth is growth predicated upon that 3% increase assessed value over time. There is more funding as some of those properties that presently have other incentives come off of those incentives and are picked up then by the urban renewal area. Next slide. Urban renewal does not impact personal property owners. Property owners for all properties within the city of Toledo, those impacts are on the taxing jurisdictions. So anybody who owns property in the city's own property taxes will not go up as a result of urban renewal, but there is an impact on all of the taxing districts who are represented within that urban renewal district, and the county being one of those. So of that proposed maximum indebtedness, the impact to the Lincoln County permanent rate levy is about $7 million. It starts out low at that $78,925. That is the 3% increase off of the properties within the urban renewal area. It doesn't impact any of the properties that are not in the urban renewal area, only those properties within the urban renewal area. It increases over time, and with that increase is the expectation that there will be some new job creation within the area and some new development in the industrial areas that will add to the capacity for the urban renewal area. Next slide. There are timing issues for this urban renewal area. We are hoping to get it established by September 1st of 2021 this year, so that it has the frozen base value of properties as of January 1st, 2020. This captures any incremental development that happened between January of 2020 and January of 2021 that will come on the tax roll in October. Next slide. The next steps for this project is to actually gain the passage of the resolutions for the public building project, to have your input on the consideration of the approval of the plan due to the right-of-way issue. And then the city council will hold a hearing and vote on August 25th. And I think that's the end of the formal presentation, and both the city manager and the mayor are still here to answer any questions about any of the projects or any of the timing questions.
Comments from either city manager or the mayor, and then yield to my fellow commissioners.
Well, I would just like to mention that the projects are not set in stone, that they're still subject to planning and budget as we go through the years. It's kind of hard to think about capital improvement projects for the next 30 years. So, and many of the categories we've left kind of purposely vague so that we can meet the needs as we come to them.
Okay, thank you. Commissioners, go ahead. I'm sorry, Mayor, go ahead.
Oh, that's all right, Commissioner Hunt. With the resolution that's before you today, I hate to say this, but it's really a housekeeping thing more than anything else. Because when it was recorded that they annexed into the city, it was an oversight somehow that that they had to be contiguous, which meant you had to have the right of way as part of the description. And I don't know how, but it fell through the cracks. And you know, with our urban renewal agency, this is the first time that the city of Toledo has ventured to go out and really come together to try and fix and clean up and really advance our town. And I just want to put to you that I think that's what we want for all of our citizens, is to have that opportunity to pull it up by their bootstraps and get her done. And that's what our community is asking for, is the opportunity to get out and do this. I thank you for your time and your consideration.
Not a problem. Commissioners, comments?
No questions for me. I thought the presentation was pretty straightforward, and I just got done being on the committee for the one in Lincoln City, so I feel pretty well versed in these at this point.
Commissioner Hall?
No questions from here either. I would agree with Mayor Cross that this is really a housekeeping technical kind of thing, and I'm certainly willing to vote in favor of approval of the plan.
You know, I'm going to do something that when we're meeting face to face and you see somebody in the audience that you think might have some relevant information, you can kind of call them out. But I see that Allison Robertson, who is the director of the Urban Renewal Agency in Lincoln City, is in our virtual audience. Allison, welcome. Any comments you wish to share with us?
Thank you, Commissioner Hunt. And fellow commissioners. I appreciate the time. I really had a few things that I wanted to say for this agenda item, though. I can't emphasize enough how important a tool economic development is, urban renewal is for economic development activities in smaller towns in particular. So I think, this is a great plan, and I look forward to supporting in any way as countywide efforts. So thank you.
Did you say you have other subjects or comments you wish to share? I'm sorry, I wasn't clear on that.
Sure, but I can do that at the end of the meeting if you'd like.
All right, we'll come back to you in public comment.
Thank you.
Thank you. The question I have is, normally we would have this come back as an agenda item in a week. Is there any urgency as far as that timing? Also, I'm not sure if I'm clear on the issue with a right of way, but part of me says if we've got an error, maybe we ought to correct it. Now, I'm not saying that we want to delay your process, but maybe we can kill two birds with one stone. So if there's no immediate urgency, I'll give us an opportunity to talk with staff about the right-of-way issue and then the other issues relative to the public buildings.
So the Toledo City Council vote is on the 25th. So if you come back on the 16th and are able to pass the resolution, then that would fit perfectly.
All right.
Or in this case, it would be
Well,
the 18th because next week we're switching back to Wednesday meetings.
Thank you, Commissioner Hall. You found the answer to the question I had before I did. All right. Good information. I think, again, urban renewal certainly is a valuable tool for economic development. We'll have this as an agenda item at our next meeting, which will be Wednesday. And I'll emphasize that again at the end of our meeting. All right. If there's nothing more on urban renewal, we'll back up to the Echo Mountain Fire update. And
I was just going to suggest with the late time that we just simply move that to next week. I think we're going to have someone from FEMA actually try to join us next week and present. So it might be kind of a more in-depth presentation than normal. So I'm fine with that if we just want to move it to next week.
that's fine with me. It will make my mother happy as she is waiting for me to take her to dinner tonight.
Well, we can't keep your mom waiting. I mean, then we're all going to be in trouble. Yeah.
Well, 97, she's a little bit touchy at times, understandably. Anyhow, I'm okay if we keep moving. So thank you for that. We'll get an in-depth report at our next meeting. And any other reports from commissioners?
Yeah, one item, Mr. Chair. As you know, I chair the Oregon Housing Stability Council, and on Friday, we approved another slate of affordable housing projects using a combination of tax credits and LIFT bonds, which are lottery-backed bonds. And I'm pleased to say that one of the projects included on that slate was 25th Street Apartments, which will be developed on Northeast 25th Street in Lincoln City and include 107 affordable units. So more details on that project to come, but a huge win for Lincoln County.
Absolutely. Anything, Commissioner Jacobson?
I will pass.
I'll just briefly indicate that I was part of a virtual meeting with the governor on Friday. All of the county board chairs were invited, and really the governor was just asking what counties were doing to address the spike in the COVID viruses. And I was frankly pleased and a bit proud to report that we have, 74% vaccination rate. We had passed our mandatory face coverings in county public space, and we're working on a policy that really echoed the governor's mandate that healthcare providers either be fully vaccinated or be tested weekly. So I felt that our county has taken a lead, and it was nice to be able to report that to the governor. Okay, if there's no other commissioner reports, public comment, and I'll recognize Allison from Lincoln City. And it doesn't say this on the agenda. It's been a long time since we've had public comment, but we ask you to limit your comments to no more than 5 minutes, please.
Great. Thank you so much, Commissioner. I really just wanted to be here for a couple of reasons. The first is to thank Commissioner Hall for her work on the Housing Stability Council. I'm glad that you mentioned the new funding, and they approved Friday the additional lift funding, which made the Lincoln City project possible. And so we'll look forward to groundbreaking in summer of 2022. And I like to say we're all in the same labor shed. We're all in the same housing shed. We're in the same economic development region. And so this is really a huge win, and I'm very excited. This has been a lot of work since 2018, when we first did a development offering and selected Innovative Housing Inc. to be our partner developer. And so anyway, I'm grateful for that. I also wanted to mention that with the EDALCS update, I can't stress enough how essential EDALC is and county economic development efforts in helping leverage the abilities of Lincoln City. Lincoln City's economic development, which includes urban renewal areas, is 1.5 staffing people. And so any way that, economic development is a team sport, and we have to rely on each other and work together. So I know Paul did a great update and mentioned a lot of things that were really helpful to Lincoln City, including the economic zone designation. But also I want to mention that I greatly appreciate the grants that the county makes available. Lincoln City has in the past years received some of those grants. And so that was great to hear that you'll move forward in a new way with those grant funds. As part of Lincoln City's economic development toolbox, we are working on some residential tools to help with creating more housing units. And we will also be looking at a childcare tool in that same economic development toolbox. So as we move along toward the end of the calendar year, we'll be taking a look at how to best craft that tool to make the most impact. So I think that's all I wanted to say. So thank you so much.
Okay, thank you. And I'll comment that if you can encourage the city of Lincoln City to contribute to the Economic Alliance, that would certainly be a factor as the county considers financial support. So thank you for that. All right. Let's see. That's public comment. Any other public comment, Casey? I know people can also submit public comment directly to the county. I see the mayor. So let's ask Casey if you can get that taken care of.
Yeah, stand by, and I'm going to go capture what we have on our website. So let me just take a moment and I will pull that up. Looks to me like we've only received 2 items this week. And if I can figure out how to myself navigate through Zoom, I can share that with you. And here you go. We've got David Gortner and Jerry Papez. Those were our 2 items we received this week. None on short-term rentals.
Okay, that covers that. Mayor, you wish to offer public comment?
Yes, thank you, Commissioner Hunt. Just 2 quick items on a couple of different presentations you had today. Number 1, Paul has been an outstanding partner in trying to help us get more economic development and more economic diversity within Toledo. And, I've spent just a small amount of time in Toledo politics, and Chris Chandler was the last person who actually came and sought us out for things. And so it's been a real breath of fresh air to work with Paul. And yes, the city of Toledo does plan on allocating funds to that effort. I want to make sure you understood that, because has proven that with the right person at the helm, things can start moving, and I've been very impressed. Also, I wanted to let you know, I didn't know if you had known, but recently our planning commission okayed a 30-unit apartment complex here in Toledo. And it'll be going through the county planning. There were some conditions that I think were valid that needed to have been put on the project. And so they're working with the county planning department to meet those goals. And one of the things that, was stated earlier was the housing, we're all in this together. Well, it's definitely true. Because when it comes to economics, childcare, housing, we can't do this alone. I mean, if the childcare ends up in Newport, it's not that bad a deal for us, because where do our people work? A lot of them work in Newport. So, the more we can work together to solve these issues, the better I feel about our future. And I just appreciate all the work you guys are doing. Keep at it. I know it's not easy. Thank you.
Thank you. I suppose I should offer anyone else that is participating or attending virtually the opportunity to enter public comment. Seeing no one come on visually or in another way indicate a desire to speak to us, I will move on and say that we are changing our meetings. We've talked about this, it's kind of gone back and forth, but our next regularly scheduled meeting of the Lincoln County Board of Commissioners will be on Wednesday, the 18th at 10 a.m. It will be virtually. There will be no meeting on Monday, the 16th. So until Wednesday, October 18th at 10 a.m. virtually.
August 18th, Mr. Chair.
Gosh, it's late. Sorry.
Yeah.
August 18th at 10 a.m. Unless there's anything else to come before the board, we are adjourned. Thank you all.